Hi and welcome to Royal Preston Hospital Day Case Unit. When you arrive at the hospital or the day of your operation, you will need to tell the person at the admissions office that you have arrived. If there is nobody there, come straight to Day Case Unit. You go up the main corridor. Day Case Unit is on the right hand side. It is signposted. You need to tell the person at the reception you have arrived. The lady will ask you to wait in the waiting area. One of the nurses will call you through to the children's bay. You will wait there. There will be toys available and a DVD to watch. The nurse who is looking after you will put a name band onto your wrist so that everyone will know who you are. The nurse will then take your temperature with a machine called a tympathic thermometer. The thermometer goes gently in your ear and beeps and tells the nurse how warm you are. Next, the nurse will check your blood pressure using a machine that attaches round your arm, which feels like an armband when you go swimming. Don't worry, it doesn't hurt. Before you go for your operation, the nurse will put some magic cream on the back of your hands and cover it with a clear plaster so that it doesn't escape. They might even draw a funny face on them. The anaesthetist also comes to visit you. This is the doctor who helps you go off to sleep before your operation. Play staff are available to help you. They can play games to help distract you and come with you when you go to sleep. When it is time for your operation, the nurse will take you and your parent or carer to see the anaesthetist. Don't forget to take your cuddly toy if you brought one from home. In the anaesthetic room, you will be asked to lie on the bed. This is the room where you'll go to sleep. A nurse will wipe off the magic cream and check your name band. Your parent or carer and nurse from the ward will be in the room with you. The anaesthetist will put a sponge peg on one of your fingers and some stickers on your chest. These are attached to a monitor that shows how fast your heart is beating and how much air is in your body. The anaesthetist will put in a little tube into your hand called a cannula. Don't worry, it won't hurt, as it goes where the magic cream has been. That area will be numb. The anaesthetist will help you go to sleep by putting some medicine into the cannula. Count to 10, you'll soon be asleep. Sometimes the anaesthetist may ask you instead to breathe into a mask and blow up a green balloon. The mask will have sleepy air coming into it, and this will help you go to sleep. When your operation is finished, you will wake up in the recovery room and a nurse will be looking after you. The nurse will send for your parent or carer to come and be with you. When you are awake, you will be taken back to the children's bay on a trolley. You can lie on the trolley or sit in the comfortable chair. The nurse will give you a drink and something to eat, usually toast. When you've had a rest, it will be time for you to go home. The nurse will give you any instructions that you might need to help you with your recovery. For example, medicines you might need to take. If you have any questions or concerns about your visit to hospital, please contact the play staff for information and help. Thank you and look forward to meeting you soon.